Minister of State for Labor and Employment has called on citizens to end stigmatization of people living with HIV and AIDS, saying it is taking its toll on citizens and accelerates their demise. The minister, who spoke during the launch of the National Workplace Policy on HIV and AIDS in Abuja, says that there is a growing need to ensure a safer and more productive workplace for victims. Marvelous Obomanu reports.
Georgina Ahamefule is a signpost of workplace stigma and discrimination against persons living with HIV and AIDS in Nigeria. In the year 2000, while working as an auxiliary nurse at Imperial Medical Center in Lagos, Georgina was sacked by her employer for contacting the virus and advised to relocate to her village and await death since she had little time to live. Although Georgina finally won a lawsuit against her employer for victimization and unfair termination of her job, other victims, still like her, continue to face one form of discrimination or the other.
People are contracting several diseases not by their own making. Once we have that, primarily, then we will also behave differently. But in Nigeria, anything negative, sickness, either it's witchcraft or because the person has committed so much sin that even God cannot forgive. I've seen places where people living with HIV and AIDS and the family have to send them away. HIV/AIDS is not a death sentence.
With a commitment to end stigma in workplaces, Nigeria's Federal Minister of Labor and Employment and other development partners have partnered to improve the existing workplace policy to protect victims. At the launch of the National Workplace Policy on HIV and AIDS in Abuja with the theme, Let Communities Lead, stakeholders say there is a growing need to ensure a safer and more productive workplace for victims.
This policy embodies our commitment to creating workplaces that are not just spaces of employment, but sanctuaries of understanding, compassion, and non-discrimination, and to provide a framework for the prevention, support, management of HIV/AIDS within our workforce.
We have focused, among others, in 5 complementary strategic areas. 1, to end HIV-related discrimination in workplaces. 2, to provide and extend HIV-sensitive social protection measures. 3, to scale up HIV testing through VTC at Work initiative.
The National Workplace Policy on HIV/AIDS is our collective document. We look forward to its implementation. We hope that all of us will work together to make all those programs and policies outlined in that particular document something that will impact Nigerian workers in all places of work and Nigerian people by extension.
With available data stating that more than 60 million people have been infected with the virus and about 50% of these further dying from the infection, Nigeria has the second highest burden, with over 3.2 million people living with HIV. Marvelous Obomanu reporting for News Central.